Hey there, it's Stephanie Apt here, your Medicare broker. I am doing just a really impromptu little video today here in my home office. And I just want to address a few things. And I know we get a lot of questions this time of year. And a lot of the questions that we're getting are about Medicare Advantage plans and how do they work. This year, more than ever, we're getting these questions because they are just kind of hammering those Medicare Advantage commercials and advertisements. And so, they're really trying to pique your interest. And I wanted to talk about them a little bit more. The other thing I want to talk about is, what sparked me to make this video is I just got off the phone with one of my longtime clients who has been on original Medicare and a Medicare supplement plan. She's not in great health. And without really knowing what she was doing, she signed up for a $0 a month Medicare Advantage plan over the phone. And she didn't understand kind of what she was getting herself into. She just was given a hard sales pitch by phone from someone that told her, listen, she's going to get dental and vision benefits that she really wants and needs. She needs to have crowns and root canals. And they were like, you're going to get dental. This plan's $0 a month. You're going to save all this money. Give us your Medicare number and we'll get you signed up. She gave them her Medicare number and she got enrolled in this plan. Luckily enough, she kind of realized when she got the card in the mail, what did I get myself into? She tried to call back the person that enrolled her, and she's been trying to reach him for over a week. He's not answering his phone, of course, because he, made a sale and now he's moved on. Luckily, she called me and we were able to kind of talk through, what her coverage that she's been used to having is like and what the Medicare Advantage plan that she accidentally enrolled in is like. I hate seeing things like this. They happen all the time with folks that do not understand this very confusing world of Medicare, and they end up getting themselves into things that they don't really understand the full ramifications of. So just a couple things that I want to touch upon today. When you're seeing all of this information about Medicare free dental and vision benefits, this is everywhere. We did a video about this last year. When you're seeing free dental and vision, what does that mean? Should I be getting free dental and vision with my Medicare? Why doesn't my plan have that? So Medicare dental and vision benefits are included with some Medicare Advantage plans. And when I say they're included with some Medicare Advantage plans, it means, they're not going to cover all of your dental and vision expenses. You're still going to have some out-of-pocket costs that you pay. Most of the plans include maybe, 2 cleanings a year or maybe up to $1,000 a year maximum or so for dental services, and maybe $100 or $150 a year for vision services like glasses and contacts. Some Medicare Advantage plans include those. When you go with a Medicare Advantage plan, these plans are heavily funded by the government. So the insurance companies have a huge incentive to get you to enroll in their plan. That's why you're seeing all of these advertisements. The insurance companies really want people on these Medicare Advantage plans. When you go with a Medicare Advantage plan, you no longer have original Medicare as your primary insurance anymore. You have a Medicare Advantage plan as your primary insurance. And so it's up to that plan if they're going to approve the procedure your doctor wants you to have done. And you have to pay usually co-pays or co-insurance or out-of-pocket medical costs whenever you go to the doctor and hospital. Medicare Advantage plans are a good fit for certain people. I'm not anti-Medicare Advantage. I work with Medicare Advantage plans, and there are certain people for which they are a really good solution. However, what I'm seeing happening a lot this time of year is that people are just kind of really attracted by, free dental or transportation benefits, whatever that plan is offering. But at the bare bones of it, when it comes to your medical coverage, your real medical insurance coverage, what are you getting? What are the pros and cons? What are the limitations? And that's what it's really important to understand. In summary, you want to know what you're getting into before you get into it. One of the biggest things that we see happen is that people go on a Medicare Advantage plan because, it sounds really good or the premium's very attractive, and they stay on it for a few years, and then they decide they want to go back to original Medicare, but then they realize that they maybe can't medically qualify for a Medicare supplement plan at that time. So the real common misconception is that during this annual enrollment period, you can go back and forth. You can go to Advantage plan and then back to supplement, or supplement to Advantage, back and forth. That's not the case. Medicare supplement plans are typically medically underwritten. So you usually have to answer health questions if you want to get a Medicare supplement plan, whether it's the annual election period, which is right now, or whether it's any time of the year. You have to go through medical underwriting to get a Medicare supplement plan unless you're first turning 65 or first going on to Medicare. So the point of me saying that is that if you switch to a Medicare Advantage plan, you may or may not be able to go back to a Medicare supplement. It's going to depend on your health. And of course, I'd be happy to explain a little bit more about what type of health conditions these insurance companies ask about and things like that. We get into that into some other videos as well. But I just wanted to make this quick video today because I've been hearing more and more of these sad stories from clients that are just getting pushed with these hard, heavy sales pressure tactics that I can't stand, and maybe signing up for something that they don't even really understand what they're getting themselves into. So before you make a decision on anything, get informed. That's what I'm here for. If you have specific questions about your plan, how it works, what your other options are, that's what we can help with. So please reach out and let me know. And if you have a Medicare supplement plan, like a Plan F or a Plan G or a Plan N, and you want to keep it, you do not need to do anything. So that's the important thing that I also wanted to stress to all my current clients. You don't need to do anything. I know we send you emails and kind of some videos re-emphasizing that every year, but with all of the ads that you're seeing, I know it's triggering, like, should I be doing something? I probably should be doing something, right? If you like what you have, generally you don't have to do anything at all, but call me with questions at any time. This is just a very, very informal video for you today. And again, thanks for watching. Thanks for being my client, and we appreciate you here. Thanks again.